Good morning, everyone, as you're entering and joining us today. I hate to tell you, Marty's sick, and so he won't be here. So everyone send good thoughts his way. So happy New Year's.
Happy
We
New
hope,
Year.
oh, thank you. We hope it's been a great start so far to 2024. This is Trio Maryland's January Zoom meeting, and we're really glad to see everyone. I'm Michelle Gregory Marin, and of course, my husband, Marty Marin, and I, we do manage Trio Maryland, and he's sorry that he can't be here today. We'd like to welcome you, and today's topic, caregivers are overlooked patients. It's such a great topic and really so often neglected, so we're really glad that you could join us. Our topic in February is introducing you to Anatomy Gifts Registry. It's really great information to help you with those end-of-life decisions. We hope to see you then. I'm now going to introduce our speaker that you're going to see has entered the Witness Protection Program. That's why you're not able to see her. Unfortunately, she's having some difficulty with her camera, but her slide presentation is still available. So no problems there. The slides to this presentation are already up on our website. So if you need to check something in the meantime, you can go to triomaryland.org and find them under speakers notes. We're very lucky today. Today's guest speaker is Rochelle Blum, clinical social worker at Johns Hopkins Hospital. Rochelle earned her master's in social work at the University of Maryland in Baltimore in 2002 and became a licensed clinical social worker in 2007. Her postgraduate work has been in healthcare, specializing in transplant. She started as a social worker intern in the emergency department at Johns Hopkins Hospital. After graduation, she took a position as a social worker on the inpatient cardiology unit. In 2005, Rochelle was introduced to transplant when she became a family advocate at the Living Legacy Foundation in Baltimore. We certainly all know who they are. She returned to Johns Hopkins a year later and became a social worker for the transplant department working with kidney disease patients. Her role includes completing psychosocial assessments to determine candidacy for transplant, problem-solving barriers to transplant, and providing ongoing support throughout the whole transplant process. And after transplant, Rochelle continues to follow the patient who may require help with various social issues that may impact their overall health as well as their transplant. Rochelle is a true asset to the transplant community, and we welcome her back. Thank you so much, Rochelle, for presenting to our group. Welcome, and I now turn the program over to you.
Thank you, Michelle. And again, I apologize. I don't know what's going on with the camera today, but at least, my slides are working all right. So I'm really thankful to have this opportunity to meet with all of you today. As Michelle said, this is an important topic, often not discussed as much as it probably needs to be. And I think most of us in this Zoom presentation have been impacted by caregiving in some way, particularly in transplant, we know, but also in the general population. Whether you're somebody that has needed care or you're providing care to someone else, this is a familiar topic for many of us. I can say my dad just turned 78 last month. And while he's relatively healthy now, it's always on my mind that as he ages, things could change. And he lives very far away in Arizona. I'm here in Maryland. So I worry. I worry about the future. I worry if something were to happen, most of the support would fall on me. My brother, while very dedicated to my father and to myself, is in Korea with his family. So I think about that. And many of my friends, I'm watching them go through a variety of caregiving situations. Their parents are aging. A particular good friend of mine Unfortunately, her father was diagnosed with Alzheimer's in recent months. And I've watched her go through a very stressful ordeal. She is not an only sibling, but her siblings live out of state. And so I think they kind of assume that she's going to be able to handle things and take on most of the brunt of this. And then to complicate things more, her father was not a very nice man for most of his life. So that's another challenging layer that you add to this caregiving situation. And he didn't take care of himself either. So I think my friend has been resentful at times of her father and her mother too. But so even though she has support from us, from her friends, in many ways, this has been a very lonely time for her and a very isolating time, which I think a lot of caregivers at times may relate to. There's a lot of rewards in being a caregiver, but there's a lot of stress that can go along with that. And so I presented on this topic before, and even for TRIO, but I wanted to sort of make it more relevant for what's going on today and to do some updates. Certainly, there have been a lot of changes in the world, particularly, with the COVID-19 pandemic. And so I wanted to sort of make sure that, yes, I'm going to talk about transplant and caregiving, but I wanted to think about, what do patients and family members want to hear most about? So we'll discuss some concrete tips for coping and hopefully managing some of the stress that can go with being a caregiver. And I'm also going to talk about some programs and resources that can make that job a little bit more manageable. And I believe my slides have been posted, but the last slide does include the names and contact information for many of those programs. Okay. So one of my main roles as a kidney transplant social worker is to evaluate patients who want to be transplanted, to see if they're a candidate for a transplant. Do they have the support that's needed? Do they have the skill set to cope and manage a transplant? Do they have an understanding of their health issues? And is there anything that's going to complicate that, like maybe an active substance use issue? So we try to problem solve, any potential barriers and get through that. But one thing that I really appreciate is when a patient brings someone with them to their evaluation. And I understand that not everybody's going to do that. And it's not required at my hospital for kidney transplant. Some of the other organ groups, it is required. Sometimes people are still in the very early stages of researching transplant. And so they might not feel a need to bring someone with them. But if they do, it tells me a couple things. Number one, it tells me that they do have some kind of support system, okay, whether they bring a spouse with them, maybe a parent or a friend. And it also lets me know that there's someone else in the room who's going to be able to hear this information. They may even be able to fill in some gaps if the patient I'm evaluating maybe doesn't know the timeline for everything. For example, when we're talking about their health history. And they give another perspective to this person I'm evaluating, who I don't have a relationship with. I'm meeting with them for a very brief moment in time, whereas this person who's in the room with them, hopefully they have a relationship. So again, they can kind of bring that unique perspective. So when I'm evaluating patients for a transplant, I make sure that I ask each and every one of them how they're adjusting to having this chronic health issue. How are they coping? What are they doing to cope? But I am the first to admit I do not check in with their caregivers on a regular basis. Sometimes I do, If it's obvious that the person in the room is having a tough time, if they bring that up, I will check in with them. And I think my colleagues are kind of guilty of the same thing. And it's not that we don't care. There may be a number of issues that we don't do this on a consistent basis. There may be time constraints. If a physician is evaluating multiple patients within a 3 or 4 hour time frame, their focus is going to be on that patient. It may be that we assume the other person in the room is okay. If it's not obvious or apparent that they're struggling, we just may assume everything's okay. And that person might not want to bring up that they are struggling because they may see that as somehow selfish, that the focus should only be on the patient, the person who has the health issue, or maybe they don't want to worry the patient, the person they care about. They don't want to burden them with another issue when they feel like they have enough on their plate. So they may not speak up. And so that's kind of how I came up with this title, because caregivers are often the overlooked person or patient in the room. They're the silent patient, in this dynamic, where they just, we overlook them. All right. So what is the definition of a caregiver? So in general, caregivers are people that provide support and assistance to a family member, friend, or an acquaintance with tasks of daily living. And that could be help with medicines, transportation to appointments. It could be very personal things like helping someone with dementia with bathing, or if they're incontinent, helping them with hygiene issues, and emotional support. So maybe this caregiver is communicating with the medical team, advocating for their loved ones. And so according to this survey that AARP did a few years ago, there are 50 million caregivers in our country today. And these, when I say caregivers, these are informal caregivers, meaning they are not paid. We know that caregivers make a big difference in somebody's quality of life. They're often the reason why people are able to maintain some level of independence in their homes, in their communities. I like this quote, and I've used this before in my presentation. So, some of you may have seen this before through that or over the internet. But this is something that our former First Lady, Jimmy Carter's wife, stated. She said, "There are only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal." So, caregiving is a public health issue. Why is that the case? So, caregivers make a big difference to our healthcare system and the economy. Even though, unfortunately, it's often a thankless job, caregivers are not often recognized in the work that they do, but they actually end up saving our economy money because, caregivers help to prevent people from being hospitalized or rehospitalized. They might take people home from the hospital versus people going to a rehab facility. So they make a big difference in terms of the overall economy and long-term care outcomes for illness and even transplant. We know that people who don't have care plans or care plans that fall apart after a transplant tend to have poorer outcomes and tend to be hospitalized more frequently or might ultimately lose, their organ. The COVID-19 pandemic really kind of showed the spotlight on the need for caregiving. people were sort of thrown into this world. I'm sorry, thrown into being caregivers, what I meant to say. Maybe they weren't caregivers before, but they suddenly became caregivers. We had parents of young children who were suddenly having to, maybe stay home from work or work from home so that they could homeschool their children. People who were socially isolated because maybe they were older or have chronic health issues like, kidney disease or other chronic health problems. Caregivers were suddenly having to tend to them because they had to be very careful and couldn't go out much anymore, couldn't do their own grocery shopping because it was a risk. And so that made a huge difference, I think, living through the pandemic, which, I'm not saying it's over, but certainly we realized the need for caregiving during that experience. When people are caregivers, it may be difficult for them to maintain their jobs. 66% of people who are caregivers are working full-time. And that can be very difficult when you have other obligations and you're caring for someone else. There is something called the Family Medical Leave Act, which basically it protects your job. So you don't have to worry that if you take off, to care for someone, to take them to an appointment, that you're going to lose your position. But most of the time, family medical leave is unpaid. So that's something, to keep in mind. And the bottom line is, I think even though we're getting better in terms of talking about caregiving and bringing light to the available programs, we need to do better. There's not enough awareness right now. So I do want to talk about the very important role of caregivers during the transplant process. The bottom line is the United Network for Organ Sharing, UNOS, requires that anybody who goes through a transplant have a solid care plan. And again, we know that people tend to do better when they have a care plan. We see better outcomes. We see less people going back into the hospital. We see less depression, anxiety, substance use when people have a good care plan. Now, by the time patients come to their transplant evaluations, caregivers are often already providing support. They may have, had to take up an extra job, a second job, or more hours at work because the person who's sick can no longer work. I know I work with, again, patients with kidney disease, and many of them are on dialysis leading up to the transplant. And they're exhausted. They're very fatigued. Some of them are able to maintain jobs, but many of them have to scale back. And so maybe their spouse or somebody else in the family is picking up more things around the house, more responsibilities when it comes to children in the household or pets. And so they're already actively providing care even when we sort of get to the point of evaluating someone for a transplant. After the transplant, there are a lot of tasks that caregivers will help out with, such as attending teaching sessions in the hospital before somebody gets discharged after the surgery, managing multiple medications. We make a lot of changes to somebody's pill box after the transplant, helping with meals or things around the house. And again, this gets added to any ongoing additional responsibilities that need to be tended to. Providing transportation to follow-up appointments and lab work after the transplant. Now, I do have some people who will say to me, well, can't I just hire someone to take care of me after the transplant? And what I tell them is, the bottom line is, yes, you might be able to get away with hiring someone, although that can be very, very expensive. But a paid aide or a paid nurse is not going to take the place of somebody who knows you, who can advocate for you with the medical team. And so that's another role that caregivers have is being your advocate. So I want to talk about some emotions, some responses to being a caregiver. And, there's no wrong or right way to feel when it comes to caregiving. The positive emotions, the negative emotions, all of that is very normal. I think caregivers have a tendency to sometimes judge themselves. And I just want to really stress that all of these things we're going to be talking about are normal reactions. Feeling overwhelmed. And I like this picture, by the way, because it kind of shows, here's this caregiver and she's holding so many different hats. She's walking the dog. She's taking care of an older parent. She's doing the grocery shopping. So, that can be very overwhelming to have that many tasks that you're doing. You might feel anxious or scared or restless. You might experience anger or frustration. Why is this happening to us? Why is this happening to the person I care about, my spouse, my child? Why is this happening to me? You might feel impatient with the person you're taking care of, and that's normal too. You might experience guilt. Why am I the person that is healthy, but my loved one is sick? You might feel resentful. This wasn't how you pictured your retirement looking, or this wasn't how I pictured, my marriage. That's a normal reaction as well. You might feel a sense of loss, or you're mourning your old life, the old life that you had before the person in your life got sick. The other thing is sometimes you might feel resentful because, that person didn't take care of themselves years ago. Maybe they didn't take their medications. Maybe they weren't seeing a doctor. So again, you might feel angry or resentful about that. And I think I mentioned this earlier on with my friend. She was taking care of somebody that was not very kind to her for many years. And so that can lead to a lot of different emotions. And sometimes, the person who's had a transplant and is taking high steroids, they might be very irritable, high doses of steroids, high doses of prednisone. They might feel irritable. They might lash out. They might take things out on you. So again, normal responses. So this next slide highlights a condition called caregiver stress or caregiver burnout. Sometimes the very normal emotions that we discussed on the previous slide can turn into something more significant or even more toxic if you don't have outlets for managing the things that we talked about, okay? And so this is a condition that strongly manifests exhaustion, anger, rage, or guilt resulting from unrelieved caregiving for a chronically ill patient. I like this next quote. This is from an article I saw on the internet through the Well Spouse Association. And so this person describes caregiver burnout as it becomes the absence of emotion, a feeling of being beaten down by circumstances so thoroughly or so often that you are not able to get back up. So you might experience a feeling of numbness or emptiness. You might feel a sense of detachment. So these can be signs of caregiver stress or burnout. This slide kind of also highlights some of the symptoms. Feeling forgetful, quick to lose your temper, feeling anxious or depressed, hopeless. Maybe you've lost enjoyment or interest in things that you used to enjoy. Extreme fatigue. You might have physical symptoms. You may experience headaches, more headaches, or GI symptoms. And you might turn to some unhealthy coping mechanisms. if you don't attend to this. You know, maybe you might drink too much, or you might pick up smoking. So these are things you really have to kind of be on the lookout for. So what are some tips and strategies for coping? What are the healthy outlets that can make a difference and prevent burnout? Asking for help. You know, start by asking for help, whether it's the social worker at the hospital or transplant center, maybe your pastor or rabbi, your family physician, a trusted friend or a relative. Let someone know you're struggling. You might want to seek support through a program such as the National Family Caregiver Support Program. Okay, they have, and we're going to talk about these programs in some of the upcoming slides, but they offer a number of different services. You might want to consider joining a support group. You know, sometimes it's helpful to know that you're not alone. So connecting with other people, you know, that have been through this before, such as TRIO, can make a big difference. And these days, a lot of support groups are virtual. So it's one less thing that you have to travel to or get to. It's easier, you know, to make time in your day for this. I encourage people to also consider talking to your human resource department if you're working, talking to your employer about existing support programs. There might be an opportunity for you to be able to work from home. I think the pandemic sort of even that was the one positive thing that might have come out of this pandemic is there is more work flexibility often now. So you might be able to flex your schedule, take advantage of family medical leave. And a lot of employer programs have something called, I didn't mention this in the slide, but they have something called EAP, which stands for Employee Assistance Program. And basically that means that you could be paired up with a counselor or a therapist, usually for a set amount of sessions, but they're free. And if you need more support after that, they will help to refer you on from there. And the bottom line is allow yourself to feel all of your feelings. You have a right to all of your emotions, even the negative ones. And when you don't, you know, again, when you don't acknowledge the negative feelings, that's sometimes when you get into trouble because you have a tendency to want to kind of stuff that down. Talk to a counselor or a therapist if that's something that you're open to. And if you haven't done it before, I know that can be kind of a daunting or intimidating task